Welcome to the Vein Clinic. This short program will introduce you to the variety of techniques currently available to treat varicose veins. These innovative procedures can effectively eliminate both small spider veins and large bulging veins. No longer is it necessary for you to suffer the discomfort of varicose veins or endure the embarrassment of their unsightly appearance. Let's talk for a minute about varicose veins and what causes them to develop. The venous system is a branching network of blood vessels through which blood returns to the heart. In the legs, there are two distinct systems of veins. First, there are the superficial veins, which lie just beneath the skin. Varicose veins develop in this system. Second, there are the much larger deep veins, which are located deep within the muscles. These large, deep veins carry most of the blood back to the heart. Therefore, superficial varicose veins may be eliminated without adversely affecting the return of venous blood. Let me repeat this important fact. When an abnormal vein is eliminated, many healthy veins remain to carry the blood. Therefore, treatment which removes abnormal varicose veins actually improves circulation in the legs. In normal veins, the direction of blood flow is up the leg. This uphill flow is helped by a series of one-way valves inside the vein. The valves are like double doors which open when blood flows up the leg and close to stop blood from flowing down the leg. But in varicose veins, these valves are absent or ineffective, so blood flows down the leg instead of up. This abnormal downward flow is called venous reflux. Watch the blood flow down this leg through a varicose vein with bad valves. Many everyday activities such as standing, lifting, sneezing, and coughing force blood down the leg towards the ankle and foot. This is what causes the legs to ache and itch and swell. This downward reflux also causes varicose veins to gradually get larger and larger. If varicose veins are left untreated for many years, permanent skin damage may occur, sometimes even progressing to open sores called venous ulcers. Treatment of varicose veins will help prevent these kinds of problems. So how are varicose veins treated? First, let's discuss the treatment of spider veins. These small vessels are best treated with a procedure called sclerotherapy. An irritating solution is injected directly into the spider vein through a tiny needle, which usually causes minimal or no pain. The injection results in an irritation or sclerosis of the inner lining of the vein. The vein closes and gradually becomes invisible. Sclerotherapy has been used safely and successfully for over 50 years. Immediately after injection, the site becomes swollen and red, similar to a mosquito bite. This quickly fades within a few minutes. Blue or purple discoloration may appear where blood has leaked out of the vein. Much like a bruise, this will disappear within a few weeks. Occasionally during treatment, new clusters of spider veins may appear. This causes a purplish discoloration called matting. This problem will resolve with additional sclerotherapy treatments, but may temporarily make an area look worse. Overall, the results of sclerotherapy are excellent. However, there are certain potential problems which you should know about. Occasionally, brown staining of the skin may develop at some of the injection sites or along the path of a vein closed by sclerotherapy. Initially, this may appear dark, but it will gradually disappear in a few months. Although permanent staining is possible, this very seldom occurs. The sclerosing solution can cause damage to the overlying skin similar to a burn. This problem occurs very infrequently. Normal healing will result in a scar that is barely visible. Any type of varicose vein treatment can be associated with blood clots in the deep veins and in the lungs. However, this is extremely rare. As is the case with any medication, there is a chance of an allergic reaction to the sclerosing solution. Fortunately, this is also extremely rare. But what about the treatment of large bulging varicose veins? The first step in treatment of large varicose veins is to use duplex ultrasound imaging to examine both the deep and the superficial veins. This computerized technology uses sound waves to produce an image like this. Normal upward flow appears blue, and abnormal downward flow from bad valves appears red. It is important to understand that very often the obvious varicose veins are only part of the problem. Other abnormal veins with bad valves may be hidden from view underneath the skin. For treatment to be successful, all the abnormal veins must first be identified and then eliminated. Several techniques are currently available for removing these large varicose veins: sclerotherapy, endovenous catheter ablation, and microsurgery techniques called ligation and ambulatory phlebectomy. Sclerotherapy can effectively close bulging varicose veins when the treatment is accompanied by duplex ultrasound imaging. This is an actual ultrasound image showing sclerotherapy of a varicose vein. You can see the needle enter the vein, the injection of sclerosing solution, and the vein closing. Occasionally, the injection may be done through an intravenous catheter to ensure proper distribution of the sclerosing solution.
I was becoming very self-conscious about my legs. I had one area in particular on my left leg which bothered me, and I would have friends and even strangers sometimes say to me, "Where did you get that terrible bruise, Terry?" And I'd have to say, "Well, it's not a bruise, it's varicose veins." I can go in and have a treatment and go out of there and just resume my normal activities. And I would highly recommend this treatment, and I have, to my friends or to anyone else who has this particular problem. It's just a very good feeling to be looking good again.
Bulging varicose veins can also be successfully treated by a procedure called endovenous catheter ablation. This innovative technique closes the vein from the inside. Under local anesthesia, a thin catheter is inserted into the abnormal vein through a small skin opening. Energy delivered through the catheter causes the vein to collapse and seal shut. Several different catheters are available in order to meet the needs of different patients.
In the morning I'm fine, but by the end of the day it really bothers me and stuff. So as time goes on during the day it swells, and then at nighttime when I'm off my feet the swelling goes down. When I'd go home my leg would hurt so bad I'd just kick back, and rest. Now I can go out and do the yard and play with the baby. And right after the procedure I had a little bit of swelling and redness and stuff, but I was able to do my normal duties right after the procedure.
Occasionally, bulging varicose veins are best treated by minor surgical techniques, which require only a few small micro-incisions. This microsurgery is very different from the traditional vein stripping operation. You will recall that varicose veins have abnormal downward flow called venous reflux. Sometimes it is necessary to tie off a vein to stop the reflux. This is called ligation. A small incision is made to expose the unhealthy vein. The vein is ligated with sutures and then divided. Ambulatory phlebectomy is a microsurgery technique which removes segments of varicose veins. A specially designed hook is inserted through the skin. The unhealthy vein is hooked and gently removed from the leg. The micro-incisions are so small that no skin stitches are required, and there is virtually no scarring.
I had a varicose vein in my calf that was really bothering me. I had a lot of pressure, a lot of pain. It was bulging. This procedure was great. A very tiny incision was made. I can barely see it. It healed up very nicely. Now my leg feels great. I don't have any more pain or pressure. It looks great, and I'm really glad that I had it done.
Well, about now you may be wondering, okay, but what treatment am I going to need for my veins? When your initial examination has been completed, the doctor will discuss with you which type of treatment is best for your particular condition. Some patients will require a combination of several different procedures. You will also be given an estimate of the anticipated cost of your treatment. It is important to wear support stockings following treatment to reduce swelling, decrease discomfort, and accelerate healing. You should expect to be able to resume most normal activities immediately following your treatment. We hope the information included in this program will help make your treatment both pleasant and successful. We want you to make an informed decision about your health care, so we encourage you to ask questions. Our office staff is happy to help you in any way we can.